Ocular anatomy and physiology, osteology and orbital contents. Knowledge of eye anatomy is important for understanding eye disease. This module includes an overview of the principles of ocular anatomy, the structure of each component of the eye and orbit, and the significance this has for understanding how the eye functions. So, it is first important to be familiar with universal terms that allow optometrists to describe the position and relations of each structure. The head is divided into three imaginary planes. We have the mid-sagittal plane, which divides the head into right and left. We have the coronal plane, which divides the head into anterior and posterior. And we also have the horizontal plane, which divides the head into top and bottom. Bones of the skull and orbit. The skull consists of 22 bones divided into those that form the cranium and those that form the face. The inside of the skull comprises three cranial fossa. We have the anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. So that's the diagram showing the cranium. We have the frontal, temporal, occipital, and parietal on the picture to my left. And the other diagram is showing the anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. This is another diagram just showing the bones to my left, and to the right side we have the cranial fossa, the three of them. The sphenoid bone is an important bone that sits within the middle of the middle cranial fossa. So this sphenoid bone on the picture, it resembles to a bat. So we have the lesser wings, which can be seen on both my left and my right upper part, those small, and we have the greater wing. So this will be very important in our discussion of orbital osteology. Posteriorly, if we take a good look, we have some superior orbital fissure, and we also have the foramen. So the eyeball sits within the bony orbit of the skull. Each of the two orbits is shaped roughly as a square pyramid, comprising an apex, base, and four walls. So that's the frontal bone, which is one of the largest, covers from the forehead to posterior part of the head. So we have the superior orbital margin limb, the zygomatic bone, infraorbital margin, we have the maxilla bone. So the bones that form the four walls of the orbit are as follows. So the roof of the orbit is formed by the orbital plate of the frontal bone and lesser wing of sphenoid. Floor of the orbit plate of the maxilla and zygomatic and the palatine bone. Those are the ones that forms the floor of the orbit, while the lateral wall is formed by the zygomatic and the greater wing of the sphenoid. And the medial wall is formed by maxilla, lacrimal, ethmoid, and the body of the sphenoid. In addition to the bones of the orbit, there are a series of foramen communicate vital nerves and blood vessels into the orbit. So these foramen are the areas where blood vessels and nerves pass through, like the superior orbital fissure and the inferior orbital fissure. These are openings that would allow the passage of blood vessels and nerves. So on this picture, we can see the optic canal, superior orbital fissure, inferior orbital fissure, to allow the passage of nerves and blood vessels. So that's another diagram just showing more details on the same, showing some of the bones that are surrounding the structure that we were just discussing. And the other arrow is just pointing the body of the sphenoid as we're discussing the bones that are forming some of these crucial areas. Paranasal sinuses. There are several paranasal sinuses or cavities within the bones that form the skull. We have the maxillary sinus, frontal sinus, ethmoid sinus, and the sphenoid sinus. The main functions are to warm and moisten the air and lighten up the skull and add resonance to your voice. You know, sometimes when you have a cough, it means these areas have been affected. So when they're affected, your voice is affected, your voice tends to change because the air spaces are filled with mucuses or they are infected. So they're important areas within our orbital for us to have clear vision, a clear voice rather. So that's a picture showing the sphenoid sinuses, ethmoid sinuses, maxillar and frontal sinuses.